So prostate cancer is the #2 cancer in men. So if you remember the numbers, once again, lung cancer is the #1 cancer for men and for women for deaths. And then the breast and prostate for men and women, and then #3 is colon cancer. So risk factors, age 65 plus. When men get older, almost every man, and when he gets to a certain age, when they get to be about 75, 80, they have some form of prostate cancer, but it's usually very, very slow growing. Certain ethnic groups, such as men, African American men, men of Jamaican descent, and who are from Africa as well, there's some kind of, genetic influence. So, and diets high in animal fat, so similar to colon cancer, low in fruits and vegetables. So by increasing fruits and vegetables, that you can see that really gives you a very big bang for your buck. So what do they do for prostate cancer? Oftentimes nothing. Is what they call watchful waiting. So they don't do anything, and they will watch the man. As we mentioned, the number of older men who have prostate cancer, they're not very likely to die from it, especially if they're in their 80s. They're probably going to die from heart disease or something else. But they may have surgery, they may have radiation, or they may have a hormonal therapy that's going to suppress their testosterone, because the testosterone is going to cause the tumors to grow. So if men are on hormonal therapies, then that's going to put them at risk of osteoporosis, because they're not going to have the testosterone to help build their bone density, and they're also going to lose muscle mass. So the treatments can be very difficult for a lot of men. There can be complications. But the overall, for men who are treated for prostate cancer, you can see the survival rates are really pretty fantastic. Anytime anybody has cancer surgery, there can be side effects that are short-term, and then they call long-term after effects. There are things that could happen years later following cancer. So that was one thing I really got out of the Cancer Exercise Trainer webinars. So things can happen short-term, they can happen immediately after cancer, they can happen a little bit more short-term, or side effects may happen years, months, or years later. So if you look at surgery side effects, some of the things we'll talk about, obviously scarring, lymphedema, we have a photo of that, so especially if the lymph nodes have been removed. Movement, you may not have range of motion in that area. For colon cancer, there's going to be some nutritional problems if it's part of the colon's been removed or part of the small intestine has been removed. Cognitive problems, sexual function if it's been a reproductive cancer, pain, from surgery, and of course emotional side effects. I mean, if you think about, you've had a surgery, you've had a major body part ripped out, that even if you can't see the changes, say, from breast cancer, we don't see it, but the person who has cancer sees this every day. So they are constantly reminded, or maybe looking at their scars, about what they're going through. So this is from the Institute of Medicine Lost in Transition chapter. So these are all the different things that can happen from any type of surgery. So you can look by the different regions of the body and find out what are some of the late effects that can happen as a result of having surgery for cancer. So they're pretty significant. So if you are working with clients who have had cancers, then you have to be aware of these, and if they've had surgery for them, that these can come on really either short-term or longer term. So this is what the limb volume test for lymphedema happens. So when a person has their lymph nodes removed, they're oftentimes going to have swelling in that limb where the lymph nodes were removed. So one of the ways they test for that is they do these limb volume tests. So it looks like just what you see on the screen, that they have a container full of water and they measure the amount of volume that is displaced from that swollen, body part. Oftentimes people who have lymphedema, say women who've had breast cancer and they've had the lymph nodes in their armpits removed in their axilla, they often have to wear a compression garment, especially while they exercise. And usually they do pretty well with that. There are also physical therapies, massage therapies, so there are lymphedema specialists who work with patients with lymphedema. So they can actually do a lymphatic drainage massage that will help facilitate movement of the lymph fluid out of that affected limb.